Cameroon is one of the 193 countries of the United Nations to have adopted and then contextualized the Agenda 2030. For its implementation, the country has chosen to integrate each of the 17 Sustainable Development Goals in its development vision, which is set for 2035. In light of these national and international commitments and in view of the urgent concerns related to improving the health of these populations and promoting gender equality, Cameroon has undertaken since 2015 with the adoption of the National Gender Policy to improve its reproductive health system and its strategy to fight against sexual violence. In order to understand the country's progress in these areas, an analysis of data from the Cameroon Demographic and Health Surveys was conducted by the National Institute of Statistics. The results of this gender-oriented analysis and the dynamics of some key health indicators made it possible to understand that at the national level, the increase in access to pre- and postnatal care that began in 2004 has led to a decrease in infant and maternal mortality. The neonatal mortality quotient known to date is around 30 per 1,000 live births. Between 2004 and 2011, the pregnancy-related mortality ratio was 782 maternal deaths per 100,000 live births, while from 2011 to 2018 there were 467 maternal deaths per 100,000 live births, a decrease of 40%. Morphologically, growth problems related to malnutrition and protein energy deficiencies are much more common among boys than girls. Analysis of this situation over the period 1998-2018 shows differences of more than 5 percentage points in favor of girls. Overall, about 1/4 to 1/3 of children under the age of 5 are abnormally tall for their age. Since 1991, the proportion of children immunized has improved significantly. Among children aged 12 to 23 months, the proportion of girls and boys immunized is about the same at 52%. On the other hand, the number of children who have not received any vaccine is increasing. Between 2011 and 2018, the percentage increased from 4 to 9% among boys and 4 to 11% among girls. The risk of death before the first birthday increased from 86 per thousand in 1991 to 51 per thousand in 2018 among boys. For girls it was 74 per thousand in 1991 to 44 per thousand in 2018. Regardless of the observation period, boys die more than girls. In spite of this decline, great efforts are still needed to reach the 25 per thousand live birth rate as set by SDGs 3. With regard to HIV/AIDS, the proportion of women with complete knowledge of the pandemic has improved since 2004, rising from 22.5% to 43% in 2018. Among men, this proportion increased from 32.2% in 2004 to 39.8% in 2018. Since 2004, the overall trend in prevalence has been downward among 15–49-year-olds. Among women, HIV prevalence increased from 6.6 to 3.4% between 2011 and 2018, compared to 4 to 2% among men for the same period, indicating that women are more infected than men. In the area of harmful practices, statistics indicate that women are significantly more sexually abused than men. Thus, between 2011 and 2018, the number of women aged 15 to 49 years who were victims of sexual violence increased from 29 to 13% among women against 10 to 6% among men. Although it has been declining since 2004, early marriage remains a women's issue. Indeed, the percentage of girls married before the age of 15 rose from 20% in 2004 to 12% in 2018. Among men, this phenomenon, although it's observed, affects since 2018 more than 5% of those under the age of 18. In fact, it has been noted that in more than 20 years, 1991 to 2018, the prejudices that hindered the emergence of women's initiatives or their empowerment and full contribution to socio-economic development have gradually faded. In order to stay the course and reduce the gender gap observed during the analysis key health indicators, it is necessary to continue education and awareness raising on sexual and reproductive health, strengthen awareness and the fight against harmful sexual practices, identify the need for ongoing or continuous updating to improve the quality of sexual and reproductive health care, rely on structures dealing with gender issues such as the Ministry of Women Empowerment and Family to ensure the operational integration of the gender approach in all socio-economic and political sectors.
Retrouvez l'ensemble des résultats de l'enquête EDS sur www.ins-cameroun.cm.